You're good to go, Dr. Sumbal.
Okay, thank you so much. Hello, everyone. I hope everyone is doing great. I'm Dr. Sumbal Ijaz, and first of all, congratulations. And why I'm saying that? Because deciding to start MRCOG itself is a huge step. And many doctors think MRCOG only about intelligence, but in reality, it's about strategy, consistency, and understanding concepts, and not mugging up the facts. Let me give you a brief in today's session. It is an introduction to how we will study for this exam, and then we will begin with one of the most high yield anatomy topic, which is the femoral triangle. Okay, give me a second so that I can log in from the other account because I'm unable to see everyone's messages. Give me a second. Okay, am I audible to everyone?
Yes, ma'am.
Okay. So this is the one of the most frequently asked question. Why we encourage everyone to give MRCOG and why we support students who are willing to pursue this journey. So what are the benefits and why we are spending a lot of our time and a lot of our money on this exam? Why? Because this is a highly recognized exam. This is one of the most privileged MRCOG, or you may say the obs and gynae specialty, or the exam which is recognized globally. That means if you have your MRCOG, you will earn high credibility in most of the countries, which also includes many of the Middle East countries as well. You may also work at the senior level in all the countries. And over the top of that, once you have your MRCOG, you can simply apply for the GMC, and you are ready to work in the UK as well. So these are the most important points which may encourage you to study for this exam as well. So when I look at these points, uh, I think if I spend a lot of my money and my time and my hard work on this journey, I feel that this is worth it. Okay, in the previous lecture, I have discussed in very detail how we can book the exam, what is the eligibility criteria, and what are the different steps you need to follow if you want to book your exam. But in today's lecture, my focus will be more on how to study for the exam and how we will begin our exam preparation. Anyhow, I will just give you a quick recap, or you may say an overview, what we have covered in the previous session. So first of all, if you are stepping up to this journey, you should have a bit understanding regarding part one. Like you should be knowing what is the exam structure, what is the exam calendar, what is the exam fee, what is the eligibility, and once you have eligibility, then how you may proceed with the booking process. Then how you're going to start your exam preparation, what study material you need, and what support or help you need from the mentors. In a nutshell, MRCUG exam, it has three parts, part 1, 2, and 3. The part 1 exam is classically about your basic understanding of the different basic subjects which you have already covered in your medical school. Then in the MRCG part 2, they will check your clinical knowledge and how you can implement that knowledge on the clinical grounds. Then in MRCG 3 exam, it is an OSCE type exam. In this exam, they classically test you on the basis of your communication skills. For instance, if a doctor who hold MRCOG, who hold GMC through MRCOG route, and now that doctor is trying to apply for a jobs in the UK. So they will assess that if this doctor is eligible to work in our NHS system, or is this doctor can adjust in our system or not. So it is more about your communication skills and how you may deal with the patients. Uh, so in a nutshell, I would say the part 1 and part 2 exam, they are theory exams, and you need to study thoroughly for these 2 exams, and these are the exam in which they test your knowledge. However, in part 3, yes, they do consider your knowledge, but they know that if you have cleared part 1 and part 2, so you have enough knowledge. So classically it is more focused on your communication skills. Exam structure, you may have 2 exams, the paper 1 and paper 2. The duration for both papers is same, which is 150 minutes. That means 2 hours and 30 minutes. In between 2 exams in 2 papers, you will get a 1 hour break. The first and the foremost step, if you are pursuing MRCOG journey, you should apply for eligibility. And I'm sure, or I'm expecting that all of you must have applied for the eligibility by this time. Please do let me know in the chat box how many of you have already applied for the eligibility. That's perfect, Dr. Faria. Very well done.
Regularization, medicine সব কমপ্লিট করে স্টিমটা পরে দেবে স্টিমের পরে
That's
ঠান্ডা
wonderful.
দেবেন একটু
Okay, I'm so glad to see that most of you have already applied for the eligibility. That means all of you are very much serious about this exam. So the topics or the subjects you need to cover for this exam includes anatomy, biochemistry, physiology, endocrinology, which is a sub-branch of physiology, microbiology, pharmacology, biophysics, pathology, genetics, immunology, embryology, clinical management, data interpretation, and stats. So this is your curriculum. These are the subjects. Uh, I know it feels like a lot at this moment, but the good thing is that you only need to cover the relevant topics which are only relevant for the obs and gynae practice. So which makes your curriculum really, really shortlisted. If we compare this with the rest of the exam like MRCS or MRCP, if we compare MRCOG Part 1, it is way easier than those exams in terms of the curriculum is really, really shortlisted. However, RCOG is really unpredictable. Maybe it seems like this is a very straightaway question. The subjects are very straightaway. The curriculum is very obs and gynae focused, but they twist around the questions and made you really confused while you are solving the exam. So what would be your booking process? All of you must have made your account on RCOG website. Many of you have already applied for the eligibility and submitted your expression of interest. So by this time, if you have done these 3 steps, this is more than enough for you. The rest of the steps you need to follow when the booking window is open. So you can just skip those steps. And now this is the time you need to focus on your exam preparation. So these are the important dates you need to keep in your mind. As you can see here, the part 1 eligibility deadline is 10th of March. So this date is for those who haven't applied for the eligibility. All of you, please listen carefully. If you are really willing to apply for the exam, please do this step as soon as possible. Why? Because this step might take 4 to 6 weeks times. And I have seen many students who got the eligibility done in 2 months time. Why? Because sometimes your application got rejected due to some error in your application. Might be you haven't attached all the documents they were expecting. So there could be any technical issues as well. So don't take any risks. Try to apply for the eligibility as soon as possible. Okay, sure. I will try to speak slowly. No worries. Okay, so the next step is expression of interest. The closing time is 24th of March. So you still have plenty of time for that. Again, don't procrastinate. Try to follow these steps as soon as possible so that your mind would be free and you can start your exam preparation as soon as possible with a relaxed mindset. Then mark this date. This is 21st of April. This is the day when your booking window would be open. And now this is the day you need to save your money. You need to save everything for which is needed for your application process. However, don't worry about this step now. We usually arrange a live session before the booking window opens. And your exam date is 30th June. Exam fee. For checking your exam fee, it is important that you need to check your band, like from which country you belong. You need to check on the RCG website. On the RCG website, they have given a list of countries which lies in band A, B, or C respectively. And once you find out your band, then you need to check your exam fee. For instance, uh, if I belong from my home country is Pakistan, so my country lies in band B. So the exam fee for MRCOG Part 1 for me or the candidates who belong from Pakistan, they need to pay, as per now, £601. Am I clear so far?
Yes, ma'am.
Okay. If anyone have any question, you may ask me anytime. You may just simply drop in the chat box. Okay, before you begin your exam preparation, this is a very common question that comes everyone's mind, that what books I need to follow, and what are the reliable resources for the exam preparation. So we recommend all of these books. For theory is the Oxford Revision Notes and Essential Revision Guidebook. Both of these books are recommended by RCOG as well. And why theory books? Usually when you start preparing for your exam, since the exam has the SBA format, but in order to solve those SBAs, you need to have some background knowledge in your mind, right? So for that background knowledge, you should have some basic books from which you can build your basic concepts or study some you just need to build your basic concepts and what are the relevant topics which are needed for this exam. And why these specific books? Uh, Although these books have all the basic subjects, including anatomy, physiology, or all the subjects which are in your curriculum, but why we focus on the RCOG recommended books? Because they included those topics which, regarding which they expect from you to have some understanding. In a nutshell, they are very shortlisted, exam-focused theory books. So that's why I usually advise the students, if you are studying anatomy, don't go after very big books like Gray's Anatomy or Snell's Anatomy. You will just simply waste your time. So try to focus on the books for the theory or concept building, which are recommended by RCOG, in which we have Oxford and Essential Revision Guide. Okay, once you have your basic knowledge, you have your theory books, you have understand the theory, then the next step and the most important step is your SPA practice. Why? Because the exam will come in the SPA format. If you have all the knowledge, you have memorized everything, but you do not have skills on solving SPAs, you haven't understand the examiner's mindset, and you didn't work on your analytical skills to solve SPAs, then that theory wouldn't help you. Is this point clear? Dr. Angam, there would be no surgeries in the Part 3 exam. That is the OSCE's type of exam, there would be different stations, and in each station, they will test you on different bases. Maybe one or three stations about the counseling of the patient, in which they have a fake patient sitting in front of you. You will get your question card outside the cubicle. You just need to address the concerns of the patient. If the question is about how would you manage this patient, then when you enter the cubicle, you just need to talk to the patient and counsel the patient and tell her regarding her management plans. And on the basis of that, they will score you. There would be no surgery in the Part 3 exam. Okay, for SPAs, we recommend SPAs by Catherine. Then Pass MRCG is a very good book. And the most important thing is that you need to practice exam-like questions, which are your recalls. And for in terms of the recalls, you at least do the last 5 years recalls and at least thrice before the exam. Okay, I will tell you in a while how would you study the theory, what points you need to memorize, and what points to skip. So be patient. I will tell you everything. Don't worry. Okay, these are the tips to follow when you have started your exam preparation. First thing first, try to focus on the high yield topics of all the subjects. And what are the high yield topics? High yield topics are the topics in which the RCOG has repeatedly asked questions. Or in other words, you may say the RCOG's favorite topics are the high yield topics. For instance, when you start practicing the recalls, you will see by yourself that there are a few topics in which they just repeatedly ask question again and again in all the exams. So the questions are highly repeated. Not exactly the question is repeated, but the topic would be similar. So we have shortlisted all the high yield topics from all the subjects. So don't worry about that. There is no need to put a lot of time or effort to find out the high yield topics. So that is on us. The second thing, since all of us have very busy schedule, and I'm still a student myself. I'm still trying to manage some time for my upcoming exams. So I totally understand it is very difficult to sit daily for 5 to 6 hours to study. So in order to find the solution to this problem, we have designed mini schedules. That means we will provide you daily task. For instance, if we have started anatomy, so we will give you mini schedule. Like for day 1, you need to cover these topics. Day 2, you need to cover these topics. So that would not only help to stay consistent in your exam preparation, but also it would make the competitive environment. For instance, if one student have done properly, they are fully prepared for that day, and you are lagging behind. So automatically that would give you a sense of competitive environment, and you will start studying by seeing your colleague. Then how would you clear your concepts? There is a lot of theory, and there are a lot of points which are maybe not that relevant to memorize for the exam. And by working by yourself, it is difficult or it is time taking when you try to clarify your concepts by yourself. So for that, we will arrange the live sessions for each module. For instance, if we have started anatomy, we will arrange the live sessions before the daily mini schedules begin. In the beginning, we will do a live session so that you will have all the foundation concepts, all the important points you need to memorize. So you have a good big picture, excuse me. So you have a big picture regarding what is coming in front of you while you are preparing for anatomy. Am I clear? Okay. And I hope I am not running too fast. I'm trying to match your pace. Okay, so now we know how we are going to clear our concepts. Then what you need to do is to practice SBAs by yourself. Because if you don't practice SBAs from the day one, then you will lag behind. And maybe you have memorized the theory very well, you have clarified your concept very well, but if you don't implement that on the SBAs, that theory is not going to help you. So practice daily SBAs, and for that we will arrange the Telegram group discussion with one of our mentor on the daily basis. Then on the website we have all the exam-like questions, and fortunately we were able to segregate all the exam-like questions in the module-wise manner. We have segregated all the anatomy recalls in a separate portion, and same goes with the physiology and the rest of the modules. So it made a lot of easier for the students for like if they have begin anatomy, they have their theory book with them. They attended the live session. They clarify their concepts, and on the daily basis they are discussing the SBAs with the mentor in the Telegram group. And by side they practice the exam like questions on the website of anatomy. So, and at the end of the day, you just polish your anatomy. Simply, I would say that. And over the top of that, what is another benefit is that you just revise all the high yield points and all the important topics again and again. First time you are going to study during the live session, then you will discuss the same concepts on the Telegram, then you solve the SBS by yourself. And if you solve, and side by side, if you solve the SBS by Catherine or the past MRCOG, you may count that you just revise the anatomy 5 to 6 times during your first go of the exam preparation. Okay, once you're done with the all the SBA practice, the live sessions, and the Telegram group discussion, at the end of the module we will arrange a mock test, which is online, and when you solve the mock, you will now able to assess yourself that where do you stand in your exam preparation. You also get evaluated by the mentor for each subject to build a strong foundation from the beginning. So this is how we are going to start our exam preparation. All the books and exam materials, ready material is available on the website. So there is no need to buy any book. You just simply log into your account, go on the books section, open the book and study from there. Okay, before we begin anatomy, I just wanted to share some tips and tricks to solve SBAs. First thing first, understand the question. The last line of the question is very important. Why? Because sometimes they will give you a scenario, and at the end of the day, at the end of the question, they just simply ask you what is the nerve innervation of that particular area. So by that way, you just waste a lot of your time on understanding the scenario. You might thinking something else, like you were trying to diagnose the patient or anything. But in the question, in the last line, they just simply ask you a very straight away question that what is the nerve innervation? So, and sometimes they question or they may ask you a question to put one in the options. So that's why if you study the last line of the question first and then start reading the scenario, that would help to save your time a lot. The second tip is that use the elimination method. What is elimination method? That if you are not sure about the answer, you don't know anything, unfortunately, if you have no clue about the answer. In that case, these tricks help you. What you're going to do on the basis of your prior knowledge, your clinical experience, or your exposure, or by using your common sense, you just simply remove the absolutely incorrect or irrelevant options. What would be happen at the end once you start eliminating? Maybe at the end you will left with the correct answer. So this is a tip. Then the third tip is don't rush, because you have plenty of time. For each question you will get 1.8 minutes. The fourth tip is that clinical reasoning. If unfortunately you just got panicked or you just got confused while solving the paper, and you have no idea what to do, then try to relate it with your clinical experience, because sometimes it helps, especially for those who just have begin their career and they just have a 3 months or 6 months of clinical experience in obs and gynae. Try to focus on the clinical things as well, because ultimately they would help you in your exam. Although in the MRCOG Part 1 exam, the clinical interpretation and clinical management, there are not many questions, or if there are questions, they would not expect you to solve at the consultant level. So the basic knowledge is enough. And lastly, practice. Key to pass this exam. And I encourage everyone, just if you are making your own schedule, please adjust that, at least revise 3 times before the exam, especially the recalls and the SPAs. You should go through all the curriculum thrice before the exam. And if you are able to do that, then nothing can stop you to pass this exam. Is this making sense to you?
No, it's okay.
Let me share you the schedule for June 26, 2026 attempt. This is our anatomy mini schedule, and as you can see on the screen, we have divided all the high yield topics on daily mini schedule basis. These are the topics. For example, day 1, you are going to begin from the anatomy of anterior abdominal wall muscles, their blood supply, venous drainage, nerve innervation, plus SPA practice in the evening with the mentor. On the second day, you are going to cover femoral sheath, ligament, anatomy of inguinal canal, femoral triangle, plus SPA practice. On the third day, you will study spermatic cord, structure of the posterior abdominal wall, and SPA practice. So now you can see we have very precisely and very smartly, we have divided the topics on the daily basis. And I don't think so it would take a lot of your time. If you can see the anterior abdominal wall muscles and their blood supply and venous drainage and nerve innervation, it hardly takes 1.5 hours. Similarly, when you practice SBS, it might take 1 or 1.5 hours for your practice. That means from the very beginning, you're spending 3 hours per day for your exam preparation, and this is more than enough. Over the top, if you stay consistent this way, that means you are spending 3 hours on daily basis, you are following the mentor, you are following the mini schedule, and you are persistent with your studies on the daily basis, exam, you will feel a lot confident in your exam preparation, and you can definitely pass the exam. This is the mini schedule for the week 2. Then we have the week 3, and in 3 weeks, we will complete the anatomy. And yes, in week 4, we would do the recap, in which we focused on high yield topics. We will practice on the recalls. You will practice recalls on the website by yourself. And at the end, we will arrange a mock test. Okay, so for now, I have discussed how you are going to begin your exam preparation, how you're going to divide the topics on the daily basis, what books you need, what is your curriculum. Another thing which many candidates face is the time management. So I have a simple tip for the time management. Try to allocate daily slots, maybe 2 to 4 hours. This is more than enough for you at this time. Try to, if you are making your study schedule by yourself, so this is the tip for those who just made their own schedules. So try to break into modules, not books. If you are starting from anatomy, try to cover anatomy. Don't just do that. Today, I am allocating 15 days for past MRCOG, then I am allocating 15 days for Catherine, and then you are going to switch on something else. Don't do that. Try to break into modules. If you are starting anatomy, try to cover that anatomy from the theory book if you want to. If you want to study from the YouTube, that's your choice. If you want to study from our live sessions, follow that from anatomy. Then try to solve the SPAs or the past recalls from the anatomy. Once you are done with that, then start physiology or any other module which you have liked to study. So this is how you need to break the modules. Use timers while studying. There is a technique which is known as Pomodoro technique, in which you study for 25 minutes and you just take a break, an eye rest. Keep 1 day or per week for revision or rest. I would say you need to take some rest since you have plenty of time. So if you are studying 6 days per week, try to take a day off, maybe on Sunday. What should be your daily balance? Study 60%. Study means your theory, your concept building, which is important by this time. If you have 5 or 6 months, then yes, you can spend a bit more time on theory, on the concept building, and SBA practice 30%. Or if you like to make your own notes or for revision, you just keep the 10% for that. But later on, yes, there is a disclaimer. Before your exam, maybe 2 months before the exam, maybe the things would be different. We will rearrange these percentages. Okay, what you will have as a premium student, you will get a website access. On our website, we have all the books, the study material which is needed for this exam, the live session recordings, subject-wise exam-like questions, year-wise exam type questions, subject-wise mock, PDF of all the subjects, flashcards, and big mock exam, which we conduct at the end of your exam preparation. Okay, I have discussed the MRCOG curriculum in detail in our previous live session. Please do let me know, do I need to repeat or not? Okay, quickly, I will just give an overview. In the RCG curriculum, they have given the topics in which they are classically going to test you. What I am trying to do right now is to build your mind, set your mind as an examiner. So when you are solving SBAs or you are studying for the exam, please think like an examiner. And for that, you need to understand the exam psychology, your question psychology. For instance, if you get a question while solving recalls or any SBA book, try to understand the logic behind the question, why the examiner is giving you that question. What is the logic behind that? What they are trying to test you. If you know that mindset, then you know how to precisely study for the exam. Okay, for that, to understand the curriculum is important because they have crystal clear, they mentioned that what are the topics they are going to test you in the exam. And they have clearly mentioned whenever there is a word comes anatomy, they are expecting the anatomy of abdomen, pelvis, and perineum. That means for this exam, if you are studying anatomy, please focus only on anatomy of abdomen, pelvis, and perineum. That's it. Don't go and waste your time studying on anatomy of upper limb, lower limb, neuroanatomy in detail, or the anatomy of thorax. So there is no need for that. So these are the points I have highlighted here. As you can see here in the knowledge area 14, they have clearly mentioned surgical anatomy of the abdomen and pelvis. Okay, in MRCOG, anatomy is not like general anatomy. You must always ask about why is this important in pregnancy? Why does it matter in surgery? And why would RCOG ask this? So these are the three things the examiner would think while making a question. And these are the same questions you need to consider when you are solving SPAs. I'm repeating this again. In anatomy, mostly they test you on why this particular thing is important in pregnancy. I will give you an example. Like if you are studying pelvic anatomy, the bony pelvis. Why you are studying bony pelvis in terms of obs and gynae? So the question they mostly ask you from the bony pelvis, which is obstetric relative. And the second sort of question is, why does it matter in surgery? Because there are many injuries that happens. There are risk of injuries during the surgeries, especially of the abdomen and pelvis and perineum. So some questions comes from that, like uretary injury, broad ligament injury. So for that, you should know the exact anatomy. What are the structures which are relevant at that particular area, and from where they are coming from. What else questions come from the anatomy? Okay, when you are studying any topic in anatomy, you should be focused on diagrams, the boundaries of the different structures, what are the contents, what is the clinical importance, and what could be the common MCQ traps. Am I clear? Okay, that's good. Now let's begin today's topic, which is femoral triangle, a small area but extremely high yield. Okay, now let's imagine you have opened a theory book and you have a topic, femoral triangle, in front of you. That book might be your Oxford revision note, or maybe essential revision guide, or maybe any other book which is theory book. And now you are studying femoral triangle. So how you're going to tackle that theory, how you would extract the important information that is only exam relevant so that you can memorize that, and how that gonna help you in solving SPAs. So what is femoral triangle? It is a wedge-shaped area formed by a depression between the muscles of the thigh. It is located on the medial aspect of the proximal thigh. It is the region of the passage of the main blood vessels between the pelvis and the lower limb, as well as the large nerve supplying the thigh. I know I have just read the lines and it felt extremely dry and you didn't comprehend anything. Same goes when you start studying the theory books, you read the lines and it felt really, really dry and you don't know what is that. So first thing first, anatomy is all about the visual study. Now let me change my strategy. Okay, as you can see here, these are the thigh, this is a frontal view, and on the medial aspect of the thigh, you can see there is a highlighted wedged area on the medial aspect of the thigh. This triangular area is known as the femoral triangle. On this diagram, you can see that again, on the medial aspect of the thigh, you can see a wedged area, and this triangular area is known as the femoral triangle. And why the nature has created this femoral triangle? Because the many structures pass through this area, especially the large nerve of the thigh. So now I'm a bit oriented when I look at this diagram. Now I know what exactly is written over here. Okay, in anatomy, as I have mentioned earlier, you need to understand the borders of the structures. For this topic, femoral triangle, we need to understand the boundaries. Another tip is that I'm sharing different methods of study by now. One method is you just read, you see the diagram, and then relate the theory, what is written over here, and look at the diagram. So for your visual memory. Another tip is that since the boundaries, they are really tricky, and memorizing these is a bit difficult task. Another tip you can do here is now to watch a video, a very short 3D model video on the YouTube. For femoral triangle, I'm going to play a very short video, and please do let me know if that video is audible to you or not.
Given that the femoral triangle is a 3D space containing some important anatomical structures, think of it as a pyramid. The mnemonic SAIL helps us to remember the lateral, medial and superior borders. That's sartorius, adductor longus, and the inguinal ligament. But there's also a floor and a roof to this 3D triangle. Let's get rid of this 2D image and bring in some 3D elements now. Got the femur there, sartorius, adductor longus, the inguinal ligament, and then down the back, pectineus and iliopsoas. So the floor of the femoral triangle is made up by the body of adductor longus, the body of pectineus, and a little bit of iliopsoas as well. Again, the floor of the femoral triangle is made up by adductor longus, pectineus, and iliopsoas. The roof is made up by the fascia lata, which is the border of the main fascial compartment of the thigh. You'll know it from the tensor fascia lata, a muscle which stretches it out on the lateral side. There's a little hole up here in the fascia lata, which is called the saphenous opening. The greater saphenous vein pops through there. And of course, the femoral triangle is open up the top to allow in its contents. And we'll take out the inguinal ligament and bring them in here. So lateral, we have the femoral nerve. Next, we have a fascial compartment called the femoral sheath, which contains the femoral artery, femoral vein, and the femoral canal. The femoral sheath ends by blending in with the adventitia, these vessels, around 4 centimeters below the inguinal ligament. The femoral canal ends earlier, up here. It contains one single lymph node. After entering the femoral triangle, the femoral nerve divides into branches which supply the muscles nearby with innervation. That's the quads, sartorius, and pectineus. It spits out anterior cutaneous branches to supply sensory innervation for the medial thigh and knee, and its saphenous branch supplies the medial lower leg. The femoral artery and vein slink down together along the bed of adductor longus and magnus, and once they're past the border of sartorius, they're out of the femoral triangle and into the adductor canal. Efferent lymphatic vessels coming out of the node in the inguinal canal then make up the deep inguinal lymph nodes of the thigh.
Okay, so I have just given a demo how you can clear your concept by seeing only 5 to 6 minute video on a YouTube. Mostly try to prefer the 3D models. They are pretty straight away. Okay, let's coming back to our topic, boundaries of the femoral triangle. They are questions which come from this topic. Let's memorize. For memorizing the boundaries of the femoral triangle, we usually use a mnemonic which is known as SAIL, S-A-I-L. What is SAIL? As you have seen on the video, we divided the femoral triangle in terms of its boundaries into lateral border, medial border, then we have base or spear border, floor, roof, and apex. So these are the boundaries. So the lateral border of the femoral triangle is made up of sartorius muscle. Don't worry, I will show you a diagram. I'm sure by the end of this lecture, you will have the boundaries of the femoral triangle, the contents of the femoral triangle, and all the high-yield questions which come in your exam on your fingertips. For now, just trust the process. Okay, we have lateral border, which is made up of sartorius muscle, we have the medial border, which is made up of adductor longus muscle. Then base or spear border is made up of inguinal ligament. The floor is made up of 4 muscles, APPIA, which this is a mnemonic, including adductor longus, pectineus, psoas major, and iliacus muscle. Roof is formed by the fascia lata, superficial fascia, and the skin. Apex of the triangle is pointed downwards towards the adductor canal. Now look at this diagram. Now understand the boundaries of the femoral triangle again. Please participate with me. Please write in the chat box how many boundaries we have in femoral triangle. Or just simply write the number of boundaries. Okay, so here we have the medial border of the femoral triangle. And here we have the lateral. So maybe in the exam, they simply ask you a question. They will give you maybe a clinical scenario, and then at the end, they simply ask you, what is the medial border of the femoral triangle is made up of? So your answer would be adductor longus muscle. This is the adductor longus muscle. And the lateral border, here you can see the sartorius muscle. But there is a twist here. Sometimes they just don't ask you a simple question that what is the medial border of the femoral triangle or what is the lateral border of the triangle. On the other hand, they may ask you from which border of the adductor longus muscle the medial border of the femoral triangle is made up of. Did you understand my question? So Lisa, if you understand my question, so please answer my question. Okay, there are 2 types of question. One question is very simple. Okay, answer me. From which structure the medial border of the femoral triangle is made up of? Okay, so all of you are saying yes, adductor longus. Okay, now I am asking another question. The lateral border, the medial border of the femoral triangle is made up of which border of the adductor longus muscle? Okay, so all of you, okay, I have got only one right question.
Madam,
I don't know the
lateral
name of the
border.
candidate because they haven't renamed themselves. Yes, so, Dr. Faria, this is how the RCOG is gonna trick you during the exam. Yes, it is the medial border. So only 2. Okay, you can see here, this is the adductor longus muscle, right? This is the lateral border of the adductor longus muscle, and this is the medial border of the adductor longus muscle. This is the femoral triangle. So the medial border of the femoral triangle is made up of medial border of the adductor longus muscle. Please note down somewhere. Is everyone clear now? Okay, let me repeat. Yes, we know this is the medial border of the femoral triangle, and this is made up of adductor longus muscle. But you can see adductor longus muscle itself have its own borders. This is the medial border of the adductor longus, and this is the lateral border of the adductor longus. And you can see the medial border of the adductor longus is towards the femoral triangle. Okay, I have written this over here. The medial border of the adductor is made up of adductor longus, its medial border. Now, if you are studying theory, what you need to do to highlight this point? Okay, my next question. What is the lateral border of the femoral triangle? Yes, that's correct, sartorius. Okay, my next question is the femoral. maybe the statement would be like that. The femoral triangle is located on the medial aspect of the thigh, which is bounded medially by the sartorius muscle. Which of the border is of the sartorius muscle is covering the femoral triangle? Medial, lateral, both? Yes, medial. Now you understand the concept. No, it's not lateral. Why? How lateral? Here you can see the sartorius muscle. This is its lateral border. This is its medial border. And here is the femoral triangle. So the medial border of the sartorius is directly towards the femoral triangle and making its boundary. Because adductor longus, this is very evident from the diagram. This is the lateral border of the adductor. This is the medial border of the adductor. And here is the femoral triangle in the center. Okay. Please note down these 2 points. Yes. Lateral border of the femoral triangle is made up of sartorius muscle and its medial border. More specifically, medial border of the sartorius muscle. Medial border of the femoral triangle is made up of adductor longus, specifically its medial border. Is everyone clear? Perfect. Then we have this border. This one is a superior border. This is very easy to remember. Simply, it is inguinal ligament. And here is the apex. So the points I have discussed are the high yield points, and these are the points which comes into exam. Okay. The next thing we need to know is the contents of the femoral triangle. Now, as you can see on the screen, there are a lot of theory points written over here, but similarly on your theory books, right? Well, what type of information you need to extract from this page? Simply the contents. What are the contents? We use the mnemonic navel if we follow from the lateral to medial side. If we follow, okay, in the exam, what they usually do, now it is very easy for you to remember the mnemonic navel. You can simply remember the contents: navel, femoral nerve, artery, vein, femoral canal, and then lymphatics. What usually happens in the exam, they just twist this. Maybe you remembered the lateral to medial relation, that first comes is a nerve, then artery, then vein, then femoral canal, then lymphatics. And if you rush while solving the SPS in the exam, this is a very simple question, and if you don't pay attention on the little details in the question they ask, you will miss this question. And what they usually do, sometimes they rotate this. Maybe in the question they have written that what are the contents of femoral triangle if we go from medial to lateral. So please write in the chat box, what are the contents of femoral triangle if we move from medial to lateral side? Yes, we will reverse the order. But sometimes they don't give all the options. They just, maybe they give a clinical scenario in which the patient is bleeding or she might have an injury to her femoral nerve, maybe anything like that. And at the end, they will ask you a question. If we move medial to laterally, what comes after the femoral artery? Or if we are moving medial to lateral, what comes after femoral vein? Or maybe they will ask you what comes after femoral nerve if we move from lateral to medial. So this is how they just, although it seems like a very simple information, you just remember the navel mnemonic and you just remember all the contents. That's very easy. But the difference is when you start solving SBAs, these are the little tricks you need to know, and you need to pay some extra attention. That's why I am emphasizing again and again, please, please, please read the question carefully, what they are asking for. Yes, I have asked so many questions in one go. Okay, now memorizing theory is not enough. In terms of anatomy, I would always suggest to see the diagrams, relate the diagrams, because it helps to have some visual memory. So by any time, literally this happens with me so many times that I was writing my exam back in, maybe, I don't remember the year, but I was writing the FCPS Part 1 exam in Pakistan. So there was a new question which came from pathology, general pathology, on inflammation. And I don't remember the exact sequence of the steps of inflammation. At that very time, I was trying to remember what could be the exact sequence. So I prepared that topic from Dr. Najib's lectures. And what comes in front of my mind, that he was just moving around during the teaching session, that this is how the leukocytes moves towards the arteries, and immigration happens and everything. So that visual memory helps me to solve that question. So sometimes it happens, the visual memory really, really helps you to solve the questions. And I passed that exam with 90%. Okay. So let's define the borders first. This is our medial side, this is our lateral side. On the medial side, the border is our longus muscle. On the medial side, we have the sartorius muscle. Let's begin. Please, you may choose. We should go from medial side, or we should start from the lateral side. Okay, let's begin from the lateral side. So from the lateral side, it is easy. We have the mnemonic navel, which is, we have the femoral nerve, you can see here. So the first content is femoral nerve if we move from lateral to medial side. Moving forward, then we have this red color structure, which is femoral artery. Then femoral nerve, then we have the femoral canal, and that's it. So this is how you just remember. And again, the boundaries, we have sartorius, we have adductor longus muscle, and these are the contents. And similarly, now try to memorize this image. If we go from medial side, you can see we first have the femoral vein, artery, and then nerve. What else we need to cover from the femoral triangle is the femoral sheath. Again, you have a lot of theory in front of you, but what points exactly you need to remember for your exam? For now, just have an orientation. I will let you know what you need to exactly memorize for femoral sheath. What happens in the femoral triangle? The contents, excluding the femoral nerve, are enclosed in a wrapping of fascia called the femoral sheath. As you can see, this is the extension of femoral sheath. The sheath is funnel-shaped, best described as a sleeve of fascia extending towards the apex of the femoral triangle. Where it fuses with the adventitia of the vessels, it is continuous superiorly with the transversalis fascia and iliac fascia of the abdomen. So there's a lot of information written over here, which is not necessary for your exam. Why would you just, if you are studying from the theory book, not just the femoral triangle, any topic. These are the points which are just for your orientation for the topic. So what else I have studied so far from this paragraph is for your orientation, that you know what is femoral sheath and where it is exactly. Each of the structure located in the femoral sheath is individually enclosed in its own compartment. The most medial compartment is the femoral canal, which contains a lymphatic vessel. The proximal opening of the femoral canal is known as femoral ring. And now this makes absolutely no sense by now unless we see a diagram. Okay, what we were talking about, the medial portion of the femoral triangle, which does not include femoral nerve, is wrapped in a sheath which is known as femoral sheath. If we go back and look at this diagram, You can see this is the green color. This is femoral sheath. And it is, you may imagine a sleeve on these contents, which clearly does not include femoral nerve. So this is your SVA in your exam, that what are the contents of femoral sheath? So please look at the diagram and answer me, what are the contents of femoral sheath? Maybe you will get a question, they will give you the question that all of these are the contents of femoral sheath except the options are femoral artery, femoral vein, femoral canal, and femoral nerve. So what would be your answer? Yes. So clearly, femoral nerve is not the part of femoral sheath. So this is your SPA. What else they have mentioned over here, that each content in the femoral sheath is wrapped in its own compartment. Now you can see here. This is the superior view of the femoral sheath, and you can see here we have femoral artery, we have femoral vein, then we have the most medial compartment, which contains lymph nodes. And you can see they have their own compartments. And clearly there is no femoral nerve here, but yes, there is a branch of femoral branch of genitofemoral nerve. So what else would be included in your options? I'm repeating my question again. All of the following are the contents of femoral sheath except the options are femoral artery, femoral vein, lymph nodes, femoral branch of genitofemoral nerve, and femoral nerve. So again, the answer would be femoral nerve. Why? Because genitofemoral nerve is the part of femoral sheath. I have seen so many students, they think there is no nerve exist in the femoral sheath. That's why I'm emphasizing on this point, because they think that femoral nerve is not the part of femoral sheath, so no nerve can dare to enter into the femoral sheath. So the femoral branch of genitofemoral nerve is the part of femoral sheath. It is a very tiny branch, but yes, that exists. Okay. So, okay, another thing you can see here, the extension of the femoral sheath. Here on the medial aspect, this is lacunar ligament. And what is the clinical significance of lacunar ligament? Sometimes when there is femoral hernia and there is a torsion going on, so the surgeons do this procedure in which they incise the lacunar ligament so that the space would be open and the femoral hernia would be reduced. Okay, when we look at the compartments, we further divide, we would see we have a lateral compartment, we have intermediate compartment, and then we have medial compartment. If you go in a very sequential manner and you know what is lateral and what is medial, it is no big deal for you. So here you can see this is the lateral and we are moving from lateral to medial side. So that makes sense. It is lateral compartment, which contains what? Okay, my question is, what is the content of lateral compartment of femoral sheath? Okay, the best answer I have got from Kinza and Truba. If I'm not pronouncing that wrong, yes. The correct answer is femoral artery and the femoral branch of genitofemoral nerve. So we have two contents in lateral compartment. Don't miss out on this nerve. Literally, if you ignore this nerve right now, you will make a very simple question incorrect in your exam. Don't forget about this nerve. Okay, Dr. Faria, my question was, what are the contents of lateral compartment of femoral sheath? Here you can see there are two dots here, the red one and the yellow one. The yellow one is for nerve, red for artery. So if you have a lot of theory in front of you, now you know what you need to remember, it's the contents. The questions I have highlighted are the points you need to highlight while whatever the subject, whatever the study resource you are following, but these are the points you need to pick from the theory. And this formula implies on all of the modules. Any theory you are studying, you need to study this way. Okay, now the rest of the things we have the femoral canal. What is the concept of femoral canal and what is femoral ring? The femoral canal is smallest anatomical compartment located in most medial part of the femoral sheath. This one here. This is the most medial compartment of the femoral sheath, which is also known as femoral canal. And what are the contents of femoral canal? It contains lymph nodes. It is approximately 1.3 centimeter long. The opening to femoral canal is located at the spear border known as the femoral ring. So if someone asks you, what is femoral canal? So what logically you will think about that? Please think and tell me, what is femoral canal? Kanza, I need anatomy. I need anatomical answer. Let me give you a cheating code. Yes, medial compartment. Dr. Atruba gave the very precise answer. It is the medial compartment of the femoral sheath. Yes, the most medial compartment. Okay. So the next concept we are left with is the femoral ring. And the femoral ring is simply the entering point of the femoral canal. That's it. What is femoral ring consistency? It is a connective tissue layer. The septum is pierced by the lymphatic vessels exiting the canal, and Plockett's node is a lymph node situated in the femoral canal. So basically, you may imagine this is a femoral sheath. This is the most medial compartment of the femoral sheath, which is known as the femoral canal, and the cap of the femoral canal is the femoral ring. That's the concept of femoral canal, femoral ring, sorry. Okay, this is another diagram. You can see this is the inguinal ligament, which is making the spear border. Then we can see the contents. If we move from lateral to medial side, we have femoral artery, we have femoral vein, and then we have this femoral canal highlighted in yellow color. So they just choose different colors. However, the sequence is similar. This is a better picture. Again, this is for you. This is a recap of this topic. You can see the inguinal ligament is making the upper border. Then we can see the contents. Here you can clearly see femoral nerve. We are moving from lateral to medial side. We have femoral nerve first content, which is separated by femoral sheath. And in femoral sheath, we have femoral artery and the genitofemoral branch, femoral branch of genitofemoral nerve. Then we have femoral vein. Then we have the entry point of the femoral sheath, which is femoral ring. And here on the most medial side, we have lacunar ligament. So if anyone have any question, we have completed femoral triangle. If anyone have any question from this topic, you may ask me now. Otherwise, I will proceed with the SBA questions. No questions? Okay. So this is your test time. Raise your question and you have 50 seconds to solve this question. Okay, time's up. The correct answer is C, very well done. And I have seen why those who would go with the option A, why? A is the inguinal ligament, and it is nowhere on the medial side. So C is the right answer. Very well done. Okay, so I want you to take a moment to share the feedback from our previous batches. The response has been extremely encouraging. Many students told us that the concepts became much clearer, especially in anatomy and basic sciences. And several candidates, they mentioned that learning with understanding rather than memorizing made a huge difference in the exam preparation. And what made me happiest was hearing that students felt more confident while attempting MRCG questions since they have built a strong foundation and they have practiced thoroughly and they just cleared all of their concepts regarding each and every MCQ, sorry, SPA. And many of them have successfully passed MRCG Part 1 and their results were truly motivate us to keep improving. So based on their feedback, we have further defined our teaching approach for you, and I'm genuinely looking forward to seeing each one of you pass this exam in their first attempt. So with consistency and trust in the process and regular practice, the goal is absolutely achievable, as you can see on the screen. All of these students, they were on the same mindset as you were right now, but with time they trust the process, they remained consistent, they follows all the guidelines, and they, as you can see, the evidence is there on the screen that they, all of them, they passed the exam, and they were truly happy, as you can see. So for technical support, or if you want to want any information regarding our premium course, or if you want to register, here on the screen, you can see there are contact details. You may contact on WhatsApp. You might contact us on Facebook, or you can simply email us on info@medinstitutors.com. Any questions so far? Yes, inshallah, Dr. Elisa. Yes, Dr. Faria, ask away. Dr. Faria, if I see the UK job market, especially at the junior level, that is highly saturated. It feels more like a bottleneck type. But after passing that bottleneck, there are a lot of opportunities at the senior level post. Thank you so much. And then another thing, Dr. Faria, there are a lot of things I usually go through from the Facebook page. There are a lot of negativity spreading on. But what I personally believe, if you are working hard, if your intentions are clear and you are not ready to give up, you are resilient, and over and additionally, if you are working in the right way with the right strategy, everything is achievable. In the Gulf countries, MRCG is highly recognized. Even the doctors who are currently working in the Middle East, they are trying to give the Royal College's exam. The reason behind is that the health system in the Middle East, they follow the UK guidelines. So that's why the Royal College exam, whether it is MRCS, MRCP, or MRCOG, that is highly recognized. Definitely. Thank you so much, everyone, for the appreciation. I totally understand the situation regarding the job market in every country and what else is going on in each home country. I'm fully aware of that. I know there's a lot of there's economical issues, there are economical crises, inflation, and everything. There's a saturation of the job market. It feels like the things are very difficult. Sometimes your goals, you feel that it is not possible for you and you will not get space anywhere. But still, even at this point, I'm still struggling. I'm still in the struggling phase. But I know there's a light at the end of the tunnel. If I give up, then yes, definitely, then I'm a failure. But if I'm trying my best and I'm hoping for the best, then I'm in the right direction. So all you need to just work on the right way, in the right strategy. Even I receive a lot of questions regarding the jobs and everything, but I think if you are working on the resume, if you understand what the employer is expecting from you and you work on your resume, for instance, if you are trying for the NHS and you build your resume on the NHS basis, like what are their expectations, what are their essential criteria, and what are their desirable criteria, and if you work on your resume, then there are very good chances for you to get a job, to secure a job, because if I think I'm an employer and I have CVs in front of me, all from the different countries, and I'm trying to shortlist, there would be a huge difference on the resume who worked in the smart way, who are trying to fit in the NHS system. Then definitely I would consider that CV on as compared to that CV which in which the candidate hasn't worked on that. So there is a difference. Dr. Fire, definitely you can do that. Yes, we are done for today's lecture. Okay, before we end today's session, I just want to remind you that MRCG is not about being extraordinary, it's about being consistent. If you show up daily, revise regularly, and trust the process, this exam is absolutely achievable. And I truly look forward to seeing every one of you succeed and celebrate your MRCG Part 1 result very soon. Thank you so much for your time and attention. Take care and keep studying smart, and I will see you all in our next session. Goodbye, everyone, and best of luck.